Mental Health Services Committee to order. First on the agenda is an issue for information only, Mental Health Director to update Committee on Mental Hygiene Local Services Plan. Hi Scott, how you doing?
Pretty good. How are you? I've sent everybody an email later this afternoon that has the integrated mental hygiene plan for the county. Every year I have to develop a integrated mental hygiene plan that provides for all of the mental health, substance abuse, and developmental disability services for the county and prioritizes what we're going to be working on for the year. So as you look at it, if you want to just cut to the chase and see what we're working on, I'd go to the last section, which is entitled Priority Outcomes, and that details everything that we're working on, the strategies on how we're going to accomplish the various goals. So that's it. I just wanted to update you on that. If there are any questions about the plan, I want you to feel free to give me a call or shoot me an email. Email's best. And I guess that's it for that, unless there's any questions on it.
Any questions? Got a quorum here? I guess we do three of them. Oh, yeah. Okay, next, Mental Health Director to update Committee on the opiate crisis in Seneca County. Information only.
Right, there's been two updated items. These are statewide initiatives that are going to have an impact on the county. The first is that Oasis has awarded, in the news brief that went out on the 21st, last Thursday, I guess that was, has awarded $1 million to the CARS program. It's the Cayuga Addiction Recovery Services. They're located in Tompkins County. They've been given $1 million for the creation of a new 25-bed adult residential treatment facility in Trumansburg. So this is good news for us. It will be something that we can access. So that's really good news. And then the other item relates to a directive that just came out actually July 6th from the New York State Office of Alcoholism and Substance Abuse Services. It's a temporary emergency capacity increase for all residential and inpatient treatment program beds. If you have a licensed residential or treatment program, inpatient treatment program, you're allowed temporarily, without a change in your operating certificate, to add 10% more beds to your operations. And you can do that for a period of 6 months. If after 6 months it looks like, and the proviso is that you have to have a 2 or 3 year operating certificate, you have to have the space available without any increased capital expenditures. You're all current in your client data reporting, and you can manage the increase without any additional staff. If you can do all that, you can add the beds. So that's actually really good news. Because there are several programs that can add beds without having to go through the hoops of Oasis regulation. After 6 months, if you still have the need, you can make petition OMA, or sorry, the Office of Alcoholism and Substance Abuse Services to make those beds permanent. So they are responding by being flexible, which is something that Oasis is not known for. So that's some good news. And that will be expanded to any program that wants to take advantage of it. So those are the two major updates.
I have a question. The $1 million grant, is that enough to build the facility?
Yeah, they have a current facility there now, so it'd be the $1 million would be to add the 25-bed addition. So yeah, that would definitely be enough for them to do that. Good. And I'm really excited about that because I know there's a need. They were looking at it primarily as the Southern Tier, initiative, which it is, but it's right next door to us, and we extend into the Southern Tier. So clearly, it's going to be something that we can use.
Well, the casino was in the Southern Tier.
Yeah, there you go. I was thinking that. I wasn't going to say it.
Okay. And the third item, any questions from the committee? Anybody from the floor? Okay. Okay, third item, Mental Health Director to provide the committee with information on myths surrounding mental health illness and violence. Information only.
Very good. I'm going to read this because there's a lot of information on here, and I apologize for reading, but after some of the concerns that were expressed at the last Board of Supervisors meeting related to the prospect of having mental health and substance abuse clinics in the same building as a daycare center, I really feel compelled to provide the board, and especially the Mental Health Committee, with information regarding the erroneous but sadly frequently held misconceptions about those with mental illness. While there are some very good reasons why our department's relocation to that Bonnet space would be ideal for tonight, I'm going to confine my remarks just to those areas related to the assertion that those with mental health issues should not be in the same building with a daycare center. So I'm going to cut to the chase, and really what people were implying is that there's somehow, people with mental illness are somehow unsafe to be around children. So I want to dispel some of the myths that are around mental illness, and particularly with the linkage between mental illness and violence. One of the first myths is that mental health problems don't affect me. The fact is that mental health problems are unbelievably common. In 2014, 1 in every 5 American adults experienced a mental health issue. That's 20% of the adult population. 1 in 10 young people experienced a period of major depression, and 1 in 25 Americans live with a serious mental illness such as schizophrenia, bipolar disorder, or major depression. Suicide is the 10th leading cause of death in the United States. It accounts for the loss of more than 41,000 American lives each year, and that's more than double the number of lives lost to homicides. So when we're thinking about violence and those with mental illness, the impact is far more pronounced on the individual who has mental illness than it is on anybody in the community. Which leads me to the second myth, which is that people with mental health problems are violent and unpredictable. The fact is that the vast majority of people with mental health problems are no more likely to be violent than anyone else. In fact, most people living with mental illness are not violent, as only 3 to 5% of all violent acts can be attributed to individuals living with serious mental illness. That means that 96% of the U.S. population that has no serious mental illness commits 95 to 97% of all the violent acts in the country. So the bottom line is that people with mental illness are not committing that. In fact, people with severe mental illnesses are over 10 times more likely to be the victims of violent crime than the general population. You probably know someone with a mental health problem and don't even realize it, because most people with mental health problems are highly active and productive members of our communities. Locally, the Seneca County Community Counseling Center has had no incidents of violence at any of its main locations in Waterloo and Ovid, nor have we ever had an incident of violence in any of our mental health clinic satellites, which are located in 3 of the 4 school districts in Seneca County. In those rare instances when someone with mental illness is violent, it's almost always directed towards themselves and to a lesser extent towards family members, which is usually not lethal. And the final myth is that children don't experience mental health problems. The fact is that even very young children may show early warning signs of mental health concerns. These mental health problems are often clinically diagnosable and can be a product of the interaction of biological, psychological, and social factors. Half of all mental health disorders show their first signs before a person turns 14 years old. And 3/4 of mental health disorders begin before age 24. Even though the New York State Department of Health and the Office of Mental Health do not gather statistics on children with mental health diagnoses per se, given that almost 30 of every 1,000 Seneca County children and youth will be involved in indicated reports of abuse or maltreatment, the state rate, I should point out, is 17, so ours is substantially higher. It can be extrapolated that there are significant numbers of children in need of mental health services in Seneca County as well. Unfortunately, less than 20% of the children and adolescents with diagnosable mental health problems receive the treatment that they need. So early mental health support can really help children. I say all this tonight because I want people to be clear that despite the highly publicized events that pair indelibly in a lot of our minds mental illness and violence, that is a statistical anomaly. It is not based in what goes on in the overwhelming majority of the people that have mental illness. So when we start saying things like, is it safe to have a mental health clinic in the same building with a daycare center? Absolutely it is. As a matter of fact, there are daycare centers licensed in treatment programs. So I know for a fact that it is. And I just want to bring these things to your attention so that when you're deciding on where and and when and how space is to be reallocated, and we move out of that building, that you understand and can make an informed decision. So,
I think it was the ignorance of people probably thinking about sex offenders being there, but you probably don't treat sex offenders, because that's probably after the fact then, right?
we do treat them, but not at any of our facilities. We have a different place, and we provide that service separate, as a matter of fact, because we don't want them in the same building. Most people with mental illness are not sex offenders.
Well, I think asking that question, and they cleared up a lot right there.
Beautiful.
To me, anyway. Correct.
What's this, I have two questions. What's the statistics on violence, violent crimes? You said the people with mental illness versus people without mental illness committing violent crimes. You gave a percentage there.
Mm-hmm.
And what was the percentage again?
I'll go back and look it up so I make sure I get it right. Only 3 to 5% of violent acts can be attributed to individuals living with serious mental illness.
So, when we talk about gun control, the fallacy of a mental health registry to say whether a person should be allowed to own a gun or not is a fallacy.
I can tell you that for the SAFE Act reports that have gone out, the overwhelming majority of them have led to no one that's in possession of a firearm or a license to carry a handgun, which is really what they can track. So, the amount of energy expended on that particular program, it's unfortunate because it's touched a handful of people positively in terms of getting a firearm from someone who probably shouldn't have it. But the overwhelming majority of people that have gone through that process and are now on a list, it's just unfortunate because it wasn't necessary.
Any other say the SAFE Act wasn't necessary?
I said that when this room was packed. I said it was probably only one of the only times that me and the people from Scope were going to be on the same side.
Any other questions for Scott on that issue? Okay, I have one question. How are we making out on these vacancies? Can you hold out longer, or aren't you filling the vacancies?
We still have some vacancies. We started 2 of our interns, so they've taken 2 of the positions of the 3 clinician positions that I had open. I still have 1 clinician position open and an additional one at a higher level that's children's mental health director. So I'm still looking in that area. I know we're going to have some retirements coming up towards the end of this year, so I know I'm going to be coming back. So right now we're treading water.
I mean, on the money-wise, we can't pay enough.
It's a perennial problem. I mean, even if I get somebody that's willing to come in and work, they're going to work here long enough to get trained to go someplace else. That's what's happened historically. So I don't anticipate that with at least one of the employees I've hired, but I do know that the other one took the exam in Cayuga County, and I know if they called, she'd be out of here in a heartbeat because they pay $9,000 a year more than we do for the same starting salary. So.
Let's keep us abreast of if you need help somehow.
Absolutely.
I appreciate you or not, but we let us know. I can't. Any more questions for Scott before we adjourn? Okay, we're adjourned. Thank you.
Call the Public Health Services Committee meeting to order. A number of issues this evening. Issue number 1,
Board of Supervisors authorizes refilling of public health nurse.
Support.
Second.
Got a motion and a second. All of the committee members should have received a copy from Vicki explaining some of these issues. We also have Mary Jo here tonight to answer some questions. For the benefit of the rest of the board, regarding this issue, one of the 3 nurses submitted her resignation and her last day was Tuesday, July 12th. Position is critical and we need to refill ASAP. And Vicki says she prefers a public health nurse, someone who has a BSN, and if not available, she would settle for a registered nurse. Any questions for Mary Jo? If not, we've had a motion and a second on this.
Move it.
All in favor?
Aye.
Opposed? So moved. Move on to issue number 2. Board of Supervisors authorizes the creation and filling of 1 service coordinator position in the health department.
So moved.
I'll second it.
Got a motion and a second. And again, Vicki's explanations. This is a new position that we are creating and filling. We were notified this week that Happiness House will no longer accept referrals for the service coordination for the early intervention program. Other than our nursing staff, Happiness House was the only agency able and willing to provide service coordination in Seneca County. And this, coupled with the fact that we were down 1 nurse and the second nurse has only been here 3 months, is placing us in crisis mode. And we are required to provide service coordination and to ensure evaluation and services are started within a specific time frame. This position will be totally at county cost, as the EI program and the preschool program are not state aid eligible programs. The only compensation we'll receive back is partial reimbursement for billable services. The vacancy committee approved this position, and Vicki's hoping that this committee will pass this resolution. And John, we've scheduled a special board meeting after the committee meeting if this resolution passes through this committee. Are there any questions?
Qualifications? What are the qualifications?
Yeah, there's about 5 or 6 in the regulation. Basically, minimally an associate's degree with at least a year or 2 service coordination experience, a bachelor degree in a healthcare field. Primarily, that's about it. Mostly service coordination experience, and where our problem is going to lie is, and this is fairly new to regulation, in the past when you had service coordinators, they have to meet those requirements, but then they also have to take an initial service coordination course, and it can be up to a year before that's in the area. And now they have to have that course prior to any service coordination, whereas before we could mentor them and get them up and running and make sure that they have at least the service coordination course within a year. And so that's going to push, even if we get someone, unless they have service coordination experience and the degree in the healthcare field, it might be pushing it out to get them up and running for a year. So they don't have to be a nurse. So we do not have to have a nursing position for this. And it would also be for the preschool children.
Thank you.
Mr. Churchill.
If that's the case, that someone has to have that certification or accreditation, whatever, why would we hire anybody but someone? I mean, why don't we make that a hard and fast requirement? I guess if what I heard you say is that person might be sitting on their hands for a year unless they have that.
I have spoken to other counties that are in the same position, because we are in a crisis mode, because it's such a time frame to implement services and have children receive the services, that other counties have applied for a waiver which I haven't done. I haven't confirmed that, but they have applied for a waiver to have a service coordinator being mentored and supervised, providing the service underneath like supervision by myself. And then when the course comes up, to then be able to take it. I haven't tried for that though.
Mr. Churchill.
Thank you, Mr. Chairman. In addition to that, now we said Happiness House was providing that service?
Yes.
Is that something that they were providing on a 40-hour-a-week basis?
No, what basically is, they have one service coordinator who services children from birth to 3 years old, and this is the early intervention program, that service Wayne County, Ontario County, Yates County, and Seneca County. So that person was a full-time service coordinator just for that. But the problem is the reimbursement is what they can bill for. They took almost $100,000 cut last year to provide the service because the time invested to meet the requirements, a lot of it is not billable. So the reimbursement isn't there. And that's why they had to pull out, and before they pulled out, we had a Seneca Cuga ARC, which is one of our largest providers in the county for children, and they want to service children because they service adults. It took them a couple of years that they finally had to back out completely of service coordination and providing services to the children. We're seeing the same thing happen with Happiness House. Happiness House is pulling out of service coordination because they can't afford it. And then I called all the local providing agencies because we're very rural. They don't bill, we can't get reimbursed to go to Hector. That takes an hour, 50 minutes to get down there. So when Happiness House was trying to provide service coordination, 3 out of 5 hours of work, or 1 hour out of 4 hours of service coordination was made available. And so none of them want to provide service coordination. And I called all the directors. I even contacted down Francisco Racker Center in Ithaca. The directors want nothing to do with service coordination. And this has been going on for quite a while.
Can I follow up? So these 4 counties, it sounds like they all need a
Yeah,
service coordinator.
I spoke.
Is there any opportunity to share a position amongst the 4 counties?
Well, I talked to Ontario County, and there's Roosevelt Children's Center in Wayne County as an agency that provides service coordination. There's Clinical Associates in Victor, New York that provide service coordination. There's another one, I can't think of it right now, that provides service coordination. But they are providing service coordination for Ontario, Wayne, and Yates counties out that way. They will not come this way. They've taken all of Ontario County's service coordination and they're maxed out. So Ontario County is in the same position. Could we share? You mean hire someone to service the other counties?
Well, it sounds like, again, you said there was a full-time person they were servicing for 4 counties.
Right.
So we had a 40-hour-a-week, so let's just say it was split equally. They were, giving 10 hours to each county. If we hired someone, it sounds to me like we're going to have a service coordinator that's not going to really have a 40-hour-a-week demand on them unless we share that with some other
They will.
neighboring county.
No, they will because.
What about, does Cuga County have any resources that we could leverage?
Actually, Cayuga County, I just got working with them for the past 3 months. We don't have a developmental toddler group in Seneca County to service children that need a structured toddler group. We always would go to Ontario County and Wayne County. So I just happened to speak to service providers in Cayuga County, and they are now coming into our county at the Calvary Lutheran Church, and it's a trial. They're bringing providers in, and we have a little developmental toddler group at the Calvary Lutheran. But these providers are traveling an hour, so they're not even sure if it's going to be feasible fiscally for them, with the numbers of children that we have. Now, we're only talking early intervention. So the service provider at a Happiness House was just early intervention, which is 0 to 3-year-olds. We're also filling this position for attending the school meetings for our preschool children, which are 3 up until they go to kindergarten. So that means going to all the meetings at all the school districts, sitting in on what are the needs of the child, and just being a member of that committee.
That's something we don't do today?
Oh my gosh, we do. But right now, we're in such a crisis mode, and that's the provision and oversight to ensure that the children get the necessary, services, but in the same regard, being fiscally responsible, because the provider can go in there and at one point years ago, oh, we're going to give them all these services, and over the summer, and it just wasn't appropriate. So my day, which we're just not able to do, is August 3rd, August 9th, August 10th, and another day we have full day meetings from 8:30 in the morning, sometime until 3 in the afternoon, listening to, going through with each of the students that are going to be going into the preschool program in the fall, and being part of those decisions of the services they're making. And so it is quite extensive. It's not just early intervention, we're also talking about the preschool. Yeah, so it would be, and then also being a non-nursing position, there are other areas that they would be able to help us out, because the problem is where we have state funding, our base grant for nursing staff, we have programs that only nurses can do. And what's happening is we're pulling the nurses from those 100% refundable programs and pulling them into the early intervention and the preschool program where you don't need a nurse.
All right. Thank you. Thank you, Mr. Chairman.
Any other questions from the committee? Any other questions from the board? Mr. Watkins?
Is there any way to look at BOCES to come up with or we really need our own independent?
We really, really need our own. We really do. And I'll tell you briefly why. Because, I do the administrative oversight of these programs to ensure that children get timely evaluations, they get timely services. And what has happened, and it's at no fault to Happiness House, once it gets away, the service coordinator, they were delayed, in some of these services. So now we're being hit with an annual performance plan from New York State. And we have 5 indicators that we didn't meet because we didn't meet certain time frames. And it's at no fault to Happiness House, but things got missed, dates got missed.
Well, this is another program that it's nobody's fault really, but people downstate don't realize the logistics of living rural upstate
No, they don't.
and the travel time. So you get penalized because you're forced to travel some distance here to provide service.
And the reimbursement rate is really nothing.
They
So-
reimburse for the service, not for the transport.
Right, it is. It's become a bear of a program, especially in administrative oversight, to ensure if, for example, when we get a child that's referred to us, the clock starts ticking. I have 45 days to go into the home, educate the parents, get all the consent signed, come back to the office, fill out all the paperwork, and find a provider. Well, Francisco Racca Center in Ithaca is not going to come to Waterloo. Ontario County has to service all these other counties, so it's pushing the timeline out. So a child right now who is referred and needs to get evaluated within 45 days, right now I had 2 children come in and they're not going to be evaluated till the end of September because they're not, because it's just pushing the timelines out. So some of the indicators that we've been that we have to reply to the state, we have no control over. Because we are rural, And it's not that many providers. Yeah, it's very difficult. It's getting harder and harder. So to lose this service coordination position from Happiness House, the bubble has just burst because we now have to do it all ourselves. Yeah.
Are there any other questions? Now, we've had a motion and a second. All in favor?
Aye.
Anyone opposed? So moved. Move on to issue number 3. Board of Supervisors authorizes and directs the county manager to sign a contract with Clean Harbors Environmental Services.
So moved.
Second. Motion and a second. And again, Vicky's notes here that they received 3 bids. One bidder, Clean Harbor, was the lowest bid. We've used them for the past several years and have been satisfied with their services. This should be clear cut, but in case any of the committee members want to review the bids, they're available at public health offices. Are there any questions from the committee? Any questions from the board? Not, we've got a motion and a second. All in favor?
Aye.
Anyone opposed? So moved. Issue number 4. Board of Supervisors authorizes and directs county manager to sign a service agreement with the S2AY Rural Health Network for FLPHA membership.
Make a motion.
Second.
Motion and a second. And again, this is an annual renewal of the FLPHA agreement. The cost is $2,000, which is the same as it had been and is paid from the Emergency Preparedness Grant and not county dollars. Are there any questions from the committee? Any questions from the board? I've got a motion and a second. All in favor?
Aye.
Opposed? So moved. Issue number 5, resolution to adopt the Think Differently initiative to assist individuals with special needs and their families.
I'll make the motion.
Second.
Motion and a second. Mr. Shepherd, do you have anything to add to that resolution?
No, the text of the resolution speaks for itself, Chairman. Nothing to add.
Anything, Mary Jo, do you have anything to add to that?
No.
The Think Differently initiative? Any questions from the committee? Any questions from the rest of the board? Not, had a motion and a second. All in favor?
Aye.
Is anyone opposed? So moved. If there's no more business to come before this board, we stand adjourned.
Mr. Heisen, you going to join us up here?
All right. Got it on that committee.
Actually, the vice chair.
He's a celebrity now.
Call the Human Services Committee to order. Issue number 1, Supervisors authorize refilling of 1 part-time aging services aide, a HIICAP Health Insurance Information Counseling Program and Office for the Aging. I have a motion on that.
Motion.
Second.
Discussion.
This is a part-time position, very critical. It helps people deal with the health insurance, counseling, navigating through that very confusing system. It's at least 20 hours a week, and it's 100% reimbursable.
Any questions? See? Yes.
I'd just like to comment that I don't think it's appropriate to call a services aide aging.
Thank you, Mr. Chairman.
I think that's civil service. I didn't make that up. Okay.
That's a pretty poor word.
Seeing none, we'll go to a vote. All in favor?
Aye.
All opposed? Motion passes. Next issue is supervisors authorize refill of one social welfare examiner for public assistance in food stamps and DHS. I have a motion.
Second.
Discussion.
Well, we've lost a second welfare examiner in the past month. This one due to medical reasons, but we have 5 welfare examiners who handle public assistance and SNAP, which is the Supplemental Nutrition Assistance Program, formerly known as food stamps. Each of these caseworkers handles 23 SNAP cases and 40 public assistance cases at this time. Every time we lose one, those cases are redistributed to other people, sometimes causing them to be a little bit behind in terms of authorizing the cases. Currently, we have about 1,600 SNAP cases and about 225 public assistance cases. Questions?
Any questions? Seeing none, we'll go to a vote. All in favor?
Aye.
All opposed? Motion passes. Third issue is Board of Supervisors directs clerk of the board to advertise for office for the aging public hearings.
Mr. Chairman, can I just have a moment just to, I'm sorry.
Okay, go ahead.
I can wait until Angela's done if you prefer.
Pardon me?
I said I can wait until you're done with Angela if you prefer. There's one other thing I wanted to bring to the attention of the committee.
Okay. Let's do this first, and we'll go back to. So, I'll read that again. Board of Supervisors directs clerk of the board to advertise for office for aging public hearings.
Motion.
Any discussion? Seeing none, we'll go to a vote. All in favor?
Aye.
All opposed? Motion passes. Okay.
I'm sorry, I just wanted to let the committee know that I'll be back here again next month. We've lost 2 more caseworkers in the area of Child Protective Services. One to a teaching position, the other to the Center for Disability Rights. And also, if you haven't heard, Peg Birmingham has resigned her position. She's retiring and moving to Florida, so I'll be here asking her to fill that position as well.
How soon?
Her last day is September the 1st.
Pretty soon?
Sold her house.
Too bad.
Yeah, it really is. I was supposed to retire first, I'm older.
Yeah, but you wouldn't know what to do with yourself.
Okay, is there any other unfinished business to come before this committee? If not, we're adjourned.
I'd call the Public Safety Committee to order. We've got 2 issues. We're filling 2 part-time sheriff deputy recruit.
I'll make a motion. By myself.
A motion and second. You want to talk to us there, Sheriff?
I just have applied for 2 part-time deputy sheriff recruits. Recently, in the past few months, since January, when I promoted John Clear to undersheriff through the promotion process, we put one of our part-timers as a full-timer. I've had a retirement in the CID section, which promotions down to put another part-timer into a full-time position, and I'm looking to hire the 2 go to basic school to become part-time officers in the middle of August.
Anybody on the committee got questions on this? Any other supervisors? Hearing none, all those in favor say aye. Aye. Those opposed? Motion carried. Issue 2 is the amend Homeland Security FY 2015 Public Safety Action Point Operations Grant. Looks like Melissa's going to talk to us on this.
Yes. I am hoping to amend the 15 PSAP operations grant. $30,000 is currently allocated towards accreditation in the 911 center. And due to time constraints, I don't believe we'll have enough time to complete that. And we are currently over budget in our overtime expenses. I'm short-staffed right now. Fully staffed, I have 17 dispatchers. I am currently down 4. So we have already spent 75% of our overtime budget. So I'm hoping to use grant funds to offset that cost instead of using county dollars.
Anybody got questions on this?
That's been approved by the grant, the Homeland Security,
sir.
right?
That was going to be my question.
I was going to say, where's this money coming from? That makes sense. So you're just going to slide the money from the grant over to pay the help?
Correct. I still hope to seek accreditation with another grant, hopefully a grant that is a multi-year grant rather than a 12-month grant that doesn't give us enough time to do that.
Is that going to be done this year or next? The accreditation for the hopefully...
Seeking accreditation, I'll have to do that with a different grant, not this grant.
A different grant this year? You don't know?
I don't know yet. I don't know yet. It depends on what comes out.
Okay.
Next, the PSAP 16 grant was already, a resolution was already approved to apply for a maintenance contract with the radio project. But there are other grants out there that I could try to work that in.
Any other questions?
Got another question.
Yes, sir.
Melissa, $1,000 question. How you doing on hiring people here? You said you're down 4? Are you?
So
we got a good door open somewhere?
Yes. So we had, one was a promotion, one a resignation, one is out on FMLA, and one is on workers' comp. So I'm hoping that 2 will come back. The other 2, we just recently offered them a position. One happens to be a transfer, which is fabulous because that saves us a lot of training. It takes approximately 8 months to train a dispatcher to do that job, and so it will help to have this transfer come in and help us out with that. So right now we're working on background checks, and so they should be able to start the 1st of September, I would suspect. We actually also changed the schedule around down there just recently, so we could hopefully save some money on overtime costs as well.
Is your staff usually budgeted for 17 full-time people?
Yes, sir.
Okay, if you're down 4, fortunately Homeland Security lets pay $30,000 overtime, but obviously we're saving money because we're not paying the 4 full-time people a wage, are we?
Well, we are actually paying 2 with FMLA and workers' comp, so we are paying 2.
On the benefit portion, right? On the benefit, what they're entitled to, the vacation, sick time, what have you, right?
Yes, sir.
The other one's workers' comp, you say?
Yes, that's correct.
Just a question.
Yes, sir. So we actually have 2 openings, so 2 salaries are not being paid. That's
Oh, so
correct.
we'll have a surplus at one end and a
Yes, that's correct.
liability in the other. Okay, that was my, and good job, by the way, of using that money instead of losing it.
Any other questions or comments? Anybody on the board? Hearing none, all those in favor say aye. Aye. Those opposed, motion carried. I have nothing else unless somebody else does for public safety. If that's the case, public safety is adjourned.
I'm awake. Ready to go? Okay. The meeting will come to order. First issue, workman's comp budget for 2017. So moved.
The 2017 workers' compensation budget, which is, must be passed by August 15th of every year. Total amount of the budget that I have is $1,118,160, which is $4,436 more than it was last year. The increases lie in the fringe benefit costs, as well as I needed to apply an increase for state assessment, as we are doing a quarterly assessment program with the state based on all of the participants' payrolls. That's only in its second year, and I anticipate that there's going to be some shifting of the percentages for charge. So I'm just trying to stay ahead of that in case there is an increase. One encouraging thing with the budget is we were able to keep our workers' compensation payments as far as the medical payments and the lost time payments. We were able to keep that flat, which is something that we strive for every year, trying to control costs and at least keep the budget as flat as possible.
Any questions? If not, all in favor, say aye.
Aye.
Any opposed? Yeah, committee adjourned.
We'll be okay.
Yeah.
We'll be okay. That's
If they did in that damn post now, you wouldn't have to move.
Yeah?
Mr. Lazaro. Mr. Lazaro. Is that you?
Reading the budget.
Well, I know you're in conversations, I was just trying to...